Hello and welcome. Today, we're diving deep into a kidney disease called tubulointerstitial nephritis, often shortened to TIN. This condition affects the tubules and the surrounding interstitial tissue in your kidneys, areas crucial for filtering waste and maintaining fluid balance. Understanding TIN is vital for early detection and effective management. Join us as we explore its causes, how it affects the kidneys, its symptoms, diagnosis, treatment, and more. So, what exactly causes tubulointerstitial nephritis? Well, the causes are diverse. Drug-induced TIN is a common culprit. Certain medications, like antibiotics, NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, and proton pump inhibitors, can trigger an inflammatory response in the kidneys. Infections, both bacterial and viral, can also lead to TIN. Autoimmune diseases, such as lupus or Sjogren's syndrome, can sometimes attack the kidney tubules and interstitium. Metabolic disorders, such as hypercalcemia, high calcium levels, and hypokalemia, low potassium levels, are less common but can contribute. Finally, exposure to toxins like heavy metals or certain plant toxins can damage the kidneys and result in TIN. To understand TIN, we need to understand the underlying process. The primary problem in TIN is inflammation and damage to the kidney tubules, which are responsible for reabsorbing essential substances and excreting waste. This inflammation then spreads to the interstitium, the space between the tubules. This inflammatory process disrupts the normal function of the kidneys. As the tubules become damaged, they lose their ability to properly reabsorb water, electrolytes, and other vital substances. This can lead to imbalances in the body. The kidney's ability to filter waste products is also impaired, leading to a buildup of toxins in the bloodstream. Over time, chronic inflammation can lead to scarring of the kidney tissue, called fibrosis, which further impairs kidney function. Tubulointerstitial nephritis can affect people of all ages and backgrounds, but its incidence varies depending on the underlying cause. Drug-induced TIN is more common in older adults and those taking multiple medications. Infections-related TIN can be more prevalent in areas with higher rates of certain infectious diseases. Autoimmune-related TIN is, obviously, associated with the prevalence of the underlying autoimmune disorder. Overall, TIN is a relatively common cause of acute kidney injury, representing a significant portion of kidney biopsies performed to investigate kidney dysfunction. Precise figures can be challenging to gather as mild cases may go undiagnosed. Recognizing the signs and symptoms of TIN is critical for early diagnosis. Unfortunately, symptoms can be nonspecific, especially in the early stages. Some people may experience no symptoms at all. However, common symptoms include fatigue, nausea, vomiting, loss of appetite, and general malaise. Changes in urine output, such as increased or decreased urination, especially at night, are also common. Patients may also experience swelling in the legs, ankles, or feet due to fluid retention. In some cases, blood in the urine, hematuria, or foamy urine proteinuria may be present. Flank pain, or pain in the side of the back, can also occur, although it's less common. If you experience any of these symptoms, it's essential to consult a doctor. Diagnosing tubulointerstitial nephritis typically involves a combination of clinical evaluation, laboratory tests, and imaging studies. A thorough medical history and physical examination are crucial. Urine analysis is performed to look for abnormalities such as white blood cells, red blood cells, and protein. Blood tests are conducted to assess kidney function, including serum creatinine and blood urea nitrogen of UNN levels. Electrolyte imbalances, such as low potassium or high calcium levels, may also be detected. Kidney biopsy is often necessary to confirm the diagnosis and determine the underlying cause of TIN. During a biopsy, a small sample of kidney tissue is taken and examined under a microscope. Imaging studies, such as ultrasound or CT scan, may be used to rule out other conditions and assess the overall structure of the kidneys. Tubulointerstitial nephritis can be broadly classified in acute and chronic forms. Acute TIN develops rapidly, over days or weeks, and is often caused by medications or infections. Chronic TIN develops more slowly, over months or years, and is frequently associated with autoimmune diseases or prolonged exposure to toxins. Beyond these broad categories, TIN can also be classified based on the specific underlying cause, such as drug-induced TIN, infection-related TIN, or autoimmune-related TIN. Understanding the specific type of TIN is important for guiding treatment and management. The treatment for tubulointerstitial nephritis depends on the underlying cause and the severity of the kidney damage. The first step is to identify and remove the offending agent, such as a medication or toxin. In cases of drug-induced TIN, stopping the medication is crucial. If an infection is the cause, antibiotics or antiviral medications are prescribed. In cases of autoimmune-related TIN, immunosuppressive medications, such as corticosteroids, are often used to reduce inflammation. Dialysis may be necessary in severe cases of acute kidney injury to support kidney function until the kidneys recover. Supportive care, including fluid management and electrolyte correction, is also important. Regular monitoring of kidney function is essential to assess the effectiveness of treatment and prevent complications. While it's not always possible to prevent tubulointerstitial nephritis, there are several steps you can take to reduce your risk. Avoid unnecessary use of medications known to cause TIN, such as NSAIDs and certain antibiotics. If you must take these medications, do so under the guidance of a healthcare provider and monitor your kidney function regularly. Stay hydrated by drinking plenty of fluids to help your kidneys function properly. Manage underlying conditions, such as autoimmune diseases and metabolic disorders, to prevent them from damaging your kidneys. Avoid exposure to toxins, such as heavy metals and certain plant toxins. If you have a family history of kidney disease, talk to your doctor about screening and preventive measures. The prognosis for tubulointerstitial nephritis varies depending on the underlying cause, the severity of kidney damage, and how quickly the condition is diagnosed and treated. In many cases of acute TIN, kidney function can recover fully with prompt treatment. However, if the condition is not treated promptly or if the kidney damage is severe, it can lead to chronic kidney disease or even kidney failure. Chronic tends to have a less favorable prognosis than acute TIN. Recent research focuses on identifying biomarkers for early detection and developing more targeted therapies to reduce inflammation and prevent fibrosis. Some studies are exploring the potential of new drugs that can protect the kidney tubules from damage. The development of novel diagnostic tools and therapeutic strategies holds promise for improving the outcomes of patients with tubulointerstitial nephritis.